See the honourable member for Calgary-Klein with 20 minutes.
Thank you, Mr. Speaker, for the opportunity to rise in this House and speak to this very important piece of legislation. Actually, a little story. When we were connecting with youth throughout the review, I remember the youth saying that they trusted government, and that if these products were so bad, then why would the government allow access and use of these products? And so I think the passing of this bill will be a very clear statement to youth and to Albertans that this is a product that is not safe for them, and there are harms associated with it. So anyway, very, very happy to be able to stand here today in support of Bill 19. Mr. Speaker, I've actually never smoked a day in my life. I never smoked anything ever once in my life, and I think the reason for that was when I was in school, whether it was elementary or junior high, and again in high school, we heard repetitively about the addictive nature of tobacco products, and we were warned about the serious health impacts that these products will have if consumed. And I think I can say with confidence, probably for yourself, Mr. Speaker, and others, that if not personally impacted by the use of tobacco products, that every member in this chamber likely knows somebody who has been impacted tragically impacted by the use of these products. It is well documented that the use of tobacco products will have serious health consequences for individuals that use them. In fact, these products can have serious health consequences for individuals that are exposed to the secondhand use of these products. It's estimated that about 50% of the people that use tobacco products will eventually die from their use. Tobacco use has cost society significantly, and unfortunately it continues to cost us. The human cost is obvious and it's devastating. There has also been the cost on our health system, and it is expected to cost the Alberta taxpayer, we just heard from the Minister of Health, $6 billion over the next 4 years. This is why it is so devastating. It was so devastating to hear that after 5 years of steady decline in the use of, or the number of Albertans who use tobacco products in this province, after 5 years of decline, we saw a spike in the number of people using tobacco. At 18.9%, we far exceed the national average in regards to tobacco use, and we have much, much work to do. In 2011 and 2012, Minister Fred Horn, the then Minister of Health, and Associate Minister Dave Rodney led the government in building a strategy for a tobacco-free future, and I believe that continues to be our goal. As a strategy to save lives, they had put a large focus on prevention, specifically strategies to reduce tobacco use amongst young people. And the good news was it was working. Tobacco use was declining in our province. All statistics, all demographics showed a decline in use. And this was reinforced by a decline in the overall sales of tobacco products in this province. That's good news. It's great news. But what was not envisioned in this report back in 2011-2012 was vaping. And since this strategy was put into place, vaping has emerged in a very major way. Its use is especially prevalent amongst young people in our province. This product was heavily marketed at convenience stores, online, and through other channels, using flavors like rainbow unicorn and cotton candy, display cases placed next to Slurpee machines, and packaging that looks similar to what you would find on a candy rack. So it's not surprising, then, that over the past 4 years we've seen year-over-year increases in the use of vaping products by youth, sold as a safe alternative to smoking. We discovered many youth were engaging in this activity because they just weren't simply aware of the harms related to inhaling a foreign substance, nor the significant risk of inhaling large amounts of nicotine. Anecdotally, we visited with a number of educators and officers from school resource officers, and we heard in one high school, or many high schools, but one in particular, up to 80% of the youth in that high school were engaging in vaping activities. 2 Edmonton resource officers that we met with literally poured out 2 massive boxes of vaping products that had been confiscated from youth in their school that they had collected from 2 high schools over a period of less than 2 months. When meeting with youth, they echoed the concerns that we were hearing from other stakeholders. The youth we met with expressed significant concern for the number of youth within their circles that were engaging in vaping activities. We heard stories of how nicotine-addicted youth were now resorting to combustible cigarettes in order to meet their cravings. We saw that in the evidence presented to us from the academics that connected or showed a clear connection between vaping amongst young people and increases in tobacco use. There's a direct correlation between the two. All that progress that we had made in reducing tobacco in this province reversed as we saw the number of tobacco users increase to 2010 levels in a mere 2 years. It became very clear that we needed action. We needed to put mechanisms in place to not only protect youth, to limit access and ensure enforcement of current laws, but also to send a clear message to Albertans that there is risk and harm associated in the use of vaping products. Under Bill 19, minors will not be permitted to consume or possess vaping products. Sales to minors will be prohibited. There will be photo ID requirements for purchase of vaping products. Display and advertising and the promotion of vaping products will be restricted. There will be restrictions on where vaping products can be sold. Smoke and vape-free areas will be expanded in order to limit the exposure that young people have and the normalization of these products. And there will also be fines associated with any violation of these above points. I need to also emphasize that there's balance found in this bill. This bill works to address the harms of vaping, but also protect adults' rights to choose for themselves, and as well as considers the interest of businesses within our communities. It is worth acknowledging that all stakeholders, including vape retailers and convenience stores that we met with and consulted in this process, supported the idea of protecting youth from the harms of vaping, and they provided excellent feedback on how we could do just that. Many vaping retailers had already been putting measures in place to limit youth access and to help reduce the prevalence of vaping amongst young people, including educating parents who were coming into their vaping retails to purchase products for their youth. Retailers we met with many of them requested government to take measures that would give them the tools to assist in reducing youth access to vaping. I believe this bill takes a large step in protecting youth from the harms of vaping and tobacco products while protecting the rights of adults to choose. I'll close with this. This legislation in and of itself is only part of the solution. Limiting youth access, implementing enforcement practices, and the other measures we've taken will bring us a long way in reducing the use of these products. But education, raising awareness of the health impacts, providing supports for individuals struggling with addiction, continuing efforts to help those who are currently experiencing the powerful impact of nicotine addiction to receive the help that they will need will be crucial next steps. I heard stories of youth that innocently enough started using vaping products, not knowing of the harms, and are now living with serious nicotine addiction. We will need to be ready to address this as a community. This bill is going to save lives, and I encourage all members of this Assembly to support it. Thank you.